Next question है, in assessing mental health, a primary health care physician may use which of the following screening tool for depression? The answer is PHQ-9 score. Most common type of breast carcinoma is, the answer is invasive ductal cell carcinoma. Cause of recurrent malaria is Plasmodium vivax. Resistance hypertension is defined as blood pressure that remains above goal despite use of 3 or more of different classes, use of 2 or more antihypertensive of one which is diuretic. The answer is use of 3 or more antihypertensive of different classes, one of which is diuretic. Which of the following is the criteria of gestational diabetes? Fasting. The answer is fasting blood sugar of more than 92. A 30-year-old lady complains of proximal myopathy. Which of the following cannot be the cause of her problem? The answer is vitamin A deficiency. Which of the following is not treatment option for chronic suppurative otitis media? The answer is tympanometry and audiometry. A 34-year-old lady presented with fever and generalized lymphadenopathy. A physician may be thinking of all of the following except generalized lymphadenopathy: malaria, tuberculosis, lymphoma, HIV. Malaria. Single most important and immediate treatment of accidental chemical injury to eye is copious irrigation of eye with ringal lactate or normal saline. A 40 years old lady presented with history of polylithiasis came to emergency with epigastric pain which relieves on leaning forward. The likely diagnosis is acute pancreatitis. Contraindication to endotracheal intubation and mechanical ventilation is untreated pneumothorax. A 38-year-old lady complaining of pin and needle sensation in both lower limbs. All of the following can be cause of peripheral neuropathy except viral diabetes, obesity. Causes of dyslipidemia can include all of the following except hyperthyroidism. A 24-year-old lady presented with epilepsy in pregnancy. A physician should avoid which medication? Carbamazepine. A 28-year-old lady presented with hypertension with pregnancy. A clinician should avoid which of the following medication during pregnancy? ACE inhibitor. A 60-year-old lady developed hospital-acquired pneumonia. A physician has to start with intravenous antibiotic. Which of the following is not good choice for hospital-acquired pneumonia? The answer is erythromycin. A primary care physician can diagnose corneal abrasion by putting fluorescence eye drops and examining under blue light. A lady was diagnosed with myasthenia gravis. She visited a nearby primary healthcare facility for sore throat and fever. Which medication should not be prescribed to avoid exacerbation of myasthenia? The answer is quinolone. All of the following can cause fulminant hepatic failure except alcoholism, acute fatty. The answer might be hepatitis D. I'm confused about it. It might be D or B. A lady was diagnosed to have pituitary mass. She presented with visual disturbances. On examination, she was found to have bitemporal hemianopia. A 56-year-old lady was diagnosed with pulmonary TB. She was started on anti-TB therapy. 2 weeks later, she presented with nausea, vomiting, and elevated AST and ALT. Which of the drug is most likely to cause ATT-induced hepatitis? The answer is pyrazinamide. A routine investigation done by a 42 years old healthy gentleman. All baseline workup for general well-being was normal but have elevated uric acid. What is the next line action in view of raised uric acid? General well-being is normal, so we will maintain good hydration. A 28 years old lady presented in ER with paracetamol overdose. Which of the following is the antidote? N-acetylcysteine. Which segment of nephron is most important in transcellular reabsorption of calcium ions? Distal convoluted tubule. Which of the following antibody it determines diagnosis of Sjogren's syndrome? The answer might be B or D, because these are the same. Treatment of perianal abscess is antibiotics and incision and drainage. Active pulmonary TB can present with all of the following except pleuroeffusion, pyrexia of unknown origin, calcified lymph node, calcified lymph node on chest X-ray in asymptomatic person. Which of the following is the cause of type 2 respiratory failure? Type 2, that is COPD. A 32-year-old man presented with chest pain in emergency. ECG is done in ER room, showed ischemic changes. All of the following can be cause of acute cardiac ischemia except the answer is high-grade fever. A medical student was auscultating precordium of a patient. Carotid pulse coincides with which heart sound? First heart sound. A 14-year-old asthmatic boy was prescribed a leukotriene inhibitors. What is the most serious side effect of these drugs according to FDA? Neuropsychiatric side effects. A 72-year-old man was taking multiple medication. He presented with sinus bradycardia of 52 beats per minute. Which of the following drugs may not be responsible? Thyroxine. A 30-year-old pregnant lady presented with gestational diabetes. Which of the following is not included in recommended management? That is sulfonylureas. Which of the following is not cause of Charcot-Marie diabetic neuropathy, tabes dorsalis, fibromyalgia? A 36-year-old lady presented with high BMI of 42 kg per meter square. Despite of all lifestyle modifications, she could not manage significant weight loss. She was offered bariatric surgery. All of the following are options in bariatric surgery except fundoplication. A 42-year-old man presented with severe dysphagia. Barium swallow showed beak-like narrowing of lower end of esophagus. What is this condition called? The answer is achalasia cardia. ठीक है, beak-like narrowing. A lady with large multinodular goiter presented for treatment option. Her thyroid function tests are normal. What is the treatment option you suggest? Large multinodular goiter. Should undergo thyroidectomy. What is Charcot-Marie? It is fever, abdominal pain, and jaundice. The basic gas exchange unit of lung is alveoli. A 60-year-old man presented with acute chest pain. ECG showed ST elevation. will lead to 3 AVF along with reciprocal changes in V1 to V3. Which coronary artery is most likely to cause of symptoms? Right coronary artery. Hemodynamic effects of respiration includes all of the following except a rise in blood pressure during expiration, a rise in JVP during inspiration, splitting of second heart sound. This except this is wrong, it occurs in expiration. In ECG, QT interval shows total duration of depolarization and repolarization. In JVP, a wave marks the right atrial contraction. A 36-year-old lady presented in ER with ascending paralysis and diagnosed to have a GB syndrome. Which of the following is not a treatment option? Prophylactic anticoagulation. A 68-year-old lady presented with cough, severe shortness of breath, chest pain for 1 day. ECG showed ST elevation in anterior leads. What is the likely diagnosis? Acute left ventricular failure. By definition, a transient ischemic attack is a neurological deficit which recovers in 24 hours. Which of the following is considered as etiological factor of GB syndrome? Etiological factor of Campylobacter jejuni. Systemic causes of non-granulomatous anterior uveitis include psoriasis, inflammatory bowel disease, Behçet's disease, all of the above. What percentage of patients with type 2 diabetes mellitus have diabetic retinopathy at the time of diagnosis? That is 30%. Which of the following is not cause of papillary edema? Hypertension, idiopathic intracranial hypertension, acute ischemic stroke, cerebral venous sinus thrombosis. The answer is acute ischemic stroke. Acute ischemic stroke.